Thank you. The chair now recognizes Mr. Sanford.
Thank you, Mr. Chairman. And again, thank you for holding this hearing. Thank the ranking member as well. What I'm hearing back home is that people are really concerned about the disconnect between what they see and what they hear. And so what they're hearing is it's not communicable, people are relatively safe, but meanwhile they're seeing pictures of people coming out of buildings wearing spacesuits, and what people are telling me back home is, I don't have a spacesuit, how am I safe? So there's a real disconnect between what they're seeing in terms of imagery and what they're hearing. I would also, though, follow up on the chairman's point. It was your words, Mr. Maryland, just a few moments ago that this disease was, quote, ferocious. Your words were that it was spreading exponentially and the largest outbreak ever of Ebola. And I asked our staff to look at, how we treated some of these things in the past. And one of the big benchmarks they used was the Spanish flu of 1918, which killed millions around the world. And the different protocols between New York City and, at that time, Pittsburgh, which were two of the bigger cities on the East Coast. And New York immediately implemented quarantine. Pittsburgh waited a month, and as a result, very, very different results in terms of death in those respective cities. New York faring quite well relative to Pittsburgh. And so what people have been saying to me back home is that, well, wait a minute, if this thing is as virulent as some folks suggest, why in the world of quarantine are we going to let people fly from that part of the world, and this is following up on the chairman's question that he's getting from his constituents as well, to this part of the world? And what you said just a moment ago was we need uninhibited travel. But last time I checked, the 101st Airborne, they don't fly on Delta. I mean, military air can get resources, people, health professionals in without having civilians going in and out. Then the second thing you said was we want to prevent these countries from collapsing economically. I think that overstates the case. I mean, from a U.S. standpoint, certainly what happens economically in Guinea or Sierra Leone is not going to drive the American economy. And vice versa, from the opposite end, we've had a travel embargo with Cuba for about 50 years now. It's not crippled the country. And so it seems to me, again, what a lot of people back home are saying to the chairman's point in question is, why wouldn't you just, if you're over there, we're not going to issue a travel visa coming over here till we get this thing sorted out. Because going back to my colleague from Utah's question just a moment ago, it seems to me that there's match between, CDC is saying, Border Patrol folks got it, and they're pointing to health care professionals. Until we get all that sorted out, why wouldn't you just say, let's just wait on travel for right now?
Congressman, those are very good questions, and they're understandable questions. I have to admit that I wince every time I see the TV images with people in spacesuits, because it gives an impression about the infectivity of the virus that is not realistic. It is an overreaction, and I think it flames people's fears about Ebola. And how Ebola is spread. Doctors Without Borders has taken care of Ebola patients for years by using established personal protective equipment that doesn't include those sort of spacesuits that you see on television, without acquiring infection in their workers. And so a little of this, some of it is unfortunately media-driven. As to the difference between the influenza epidemic of 1918 and Ebola, there are really major differences.
Understood, but I see we've gone to a yellow light, and I know we have a couple seconds left, but why not, again, prohibition on civilian travel from this part of the world, that part of the world? If you're over there, don't come here. Why not?
We feel that would cause the disease to grow in that area and to spill over into other countries, and then spill over more into the U.S. And the real opportunity now to put out that disease there. And every travel restriction that's been placed on travel into that area has interfered with people who are trying to help not being able to get there. Now, either travel restrictions or reduction in air travel, and it's not just the U.S. military. You know, it's people from Europe, it's people from China, it's people from Cuba who are trying to get there to help, and it would make doing what we need to do harder, and that's why we ask the American people's understanding of that.
I hear you. I have questions on that, but my time has expired. Thank you, Mr. Chairman.
Thank the gentleman, Mr. Barber.